here who is being deployed that you're seeing today has left their family, left their home, left their job, or left their college. So this is a big sacrifice from them, big sacrifice that they are making, and we appreciate it very, very much. I want to just be here personally to thank them for doing that. National Guard, when we think about the deployment of the National Guard, I guess before I get to the government, tornadoes, floods along the Ohio River, other natural disasters. The National Guard throughout this pandemic has played a crucial role. Early on, when volunteers that would normally man food banks could not go, National Guard went and kept the food banks and kept the food going. National Guard was involved very early on in testing, and they became involved in giving vaccinations. We've had the National Guard go into places where sometimes people who were there didn't have access or as much easy access to the vaccinations. Fran and I have been in places where the National Guard has come in. We've asked them to come in and go to high-rise elderly housing, senior housing, and other places. So they continue to play a major role. This deployment over 2,000 members of the Ohio National Guard is different. This is into our hospitals. The role is to keep our hospitals going. All of us depend on our hospitals to protect us, and now the National Guard is involved in protecting our hospitals and enabling them to continue to protect all of us. Fran and I, as you saw, talked to a number of members of the Guard, and they're doing all kinds of different things in their life. Construction, HVAC, a teacher, all kinds of different things. A number of them were students. So we just appreciate what they're doing. We hope to get them back to their regular life as soon as possible. But each one that we talked to, had the attitude, this is our mission, and this is what we need to do. I'm going to ask the General Harris to describe kind of where we are in regard to this. They're finishing up really the deployment of the second tranche of members of the Guard, and they're getting assignments today, and then we'll be in hospitals tomorrow. General?
Thank you, sir. Sir, if I could, I'd like to first start by thanking those of our healthcare community. One only needs to go into the hospital for one visit to realize that the anecdotes really don't do justice to what's really happening in our hospitals and the strife that they're experiencing right now. And many of those healthcare workers that have been in the trenches for 22 months and working tirelessly, and they're tired, and they're overworked, and they're overwhelmed. And when you walk into an emergency department and see patients in beds in the hallways waiting for rooms, you realize the significance of the crisis that's occurring in our healthcare system right now, which is why we're here. And today we're in the process of finishing up the second wave of the mobilization, which is another 1,250 individuals to come on duty to support these hospitals and help alleviate the crisis. In short, our role is to help expand the capacity, help the clinical staff in the hospital create more bed space so that they can continue to take care of Ohio's sickest patients and ensure that when people come into hospitals, they get the level of care that they need. We're doing that in a variety of ways. One of the most important things that we're doing is standing up testing sites, and we're in the process of standing up more as we speak, because we know that people are going to the emergency departments in the hospitals for nothing more than to get a COVID test, and we need to relieve that stress. So we're establishing testing sites in the vicinity of the hospitals, but to relieve that pressure on the hospitals so that the emergency departments can take care of sick and injured people. Our service members are doing tasks, everything from being sitters, keeping eyes on people in the hospital that need to be observed, to helping in the environmental services department. Beds are so vital. The ability to turn beds quickly and get people out of the emergency department and into those ICU beds or other beds in the hospital is critical. So our folks are helping turn those beds as quickly as possible. They are helping with general administrative tasks and anything else they're asked to do in those hospitals that can free up those clinical staff to go staff beds so that the healthcare system can continue to take care of Ohio's sick and injured people. And that's exactly what we're doing. So right now, the preponderance of our forces are arrayed across the northern end of the state. I'd say that 65% of the people we have out there right now are across that northern strip, what we call Zone 1 in the healthcare vernacular. Zone 2 probably has about 20% and about 15% down in the lower half of the state. Now, we do anticipate that shifting. We work very closely with the Department of Health and with the Ohio Hospital Association as we surveil this disease and watch what's happening with it. We want to maintain the ability to lift and shift our forces as necessary to provide the support where it's most needed in the state. But right now, that's in the northern part of the state, and that's where the majority of our forces are arrayed. I couldn't be more proud of our soldiers and airmen who've shown up. Nobody signed up to do this when they looked at the recruiting poster and decided to join the military, but they've come and they've maintained a positive attitude, and the reception that they've received when they've gone into the hospitals has been extraordinary, absolutely extraordinary. Even more compounding is the fact that, of course, they did this over the holiday season, and quite frankly, when we called them, they didn't flinch. When the governor said we need them, when the healthcare system said we need them, Governor DeWine said, "General, move out." I will tell you, I couldn't be proud of the way our soldiers and airmen responded.
General, I'll be happy to take any questions.
Governor, what about more testing? I know the General mentioned it, and I know we've seen in Cleveland that testing has been immensely popular. I know the CAS site here in Central Ohio. What can the state do to get more free drive-through testing sites up in the state?
You're going to see more of those sites up in the next few days. I just looked at the list that's coming. So you're going to see a lot more sites around the state of Ohio, and the National Guard is enabling us to do it. They obviously have two purposes. One is to relieve the number of people who are going into the emergency room for the sole purpose of getting that test. But also, we know that we need more people have more access to tests. Number of places around the state of Ohio that people can go to get tests, but we also know that sometimes there is a backlog. The reality is that since the beginning of this pandemic, this country has not had enough tests. That situation continues, even though we have, for example, in our office, the health department, we bought 5 or 6 million tests that we have distributed in December. We distributed 1 million tests in Ohio. 1 million free, I think, in December. We intend to distribute over 1 million in January. So we're going to continue to do that, but we also know that nationwide there's simply just not enough tests.
Governor, have you talked with the leaders of your party in the State House at all about any potential action that you or they or DeWine could take to try and ramp up the amount of people that are getting vaccinated to try and bring this pandemic down?
Well, I have worked, and I will say that health departments around the state have worked. We have pharmacies that have worked. We have so many people involved in this. We have over 2,000 locations in the state of Ohio where people can become vaccinated. On the good side is we have now 70% of the adults in the state 18 years of age and older who have been vaccinated. Counter side of that is we have 30% who are not. And as we are now in January, where this Omicron is spreading like wildfire around the state, just as it has done every other place that it has gone, it is crucial. If you're not vaccinated, this is a time to immediately get vaccinated. For those people who have been vaccinated but who have not gotten their booster shot, this is now the time to get the booster shot. So it is imperative to do that. Our job, I think, is to communicate to people the importance of it, to give them the facts that we can, tell them to You know, if they have questions, go talk to their own individual doctor. Their individual doctor is the best person for them to be talking to about the importance of the shot. The other thing that we've had an obligation, I think, to do is make sure these shots are available. They are available. There are many, many places since the beginning of this pandemic. Our goal has been to get the vaccine out to as many locations as we can. We have also, if I could just finish, we have also gone right back into our nursing homes. Once we finished the initial round a number of months ago in our nursing homes, which was a high priority because we know that's where we've seen a lot of people die, once we got through with that, we set up the follow-up system, which is in place in the state of Ohio now, where nursing homes can get through their normal provider those booster shots, and anybody who comes into that nursing home who's not had a booster shot can get that booster shot. Go ahead, you had a follow-up.
To be clear, you've not had any conversations with Senate President Matt Huff and House Speaker Robert Cupp about doing anything to further try and get more people to get vaccinated?
Oh, I talk to them a lot. I mean, I talk to the Speaker, I talk to the Senate President a lot. I tell them what we are doing. I try to keep them up to date. I made it clear to them, you know, I told them about what we were doing with the Ohio National Guard. So no, we continue to talk. You know, we think we are doing everything that can be done to make shots available to people and to inform people about the shots. You know, if we have I ask my team every day, and I ask myself many, many times a day, is there anything else that we could be doing? Because we know that our hospitals are being filled up today with unvaccinated people by and large. And if more people were vaccinated, we would see fewer people end up in the hospital, and candidly, we would see a lot fewer people who are dying. I think the thing that keeps me up at night, the thing I think about every single day, many times each day, is the 40-year-old or the 45-year-old or the 50-year-old who did not get vaccinated, who has died, or who is on a vent, or is ICU. These are human tragedies that are immense for those families. And so we're constantly looking for anything else that we could do to encourage people to get more vaccinated.
Governor, when I talked to Major General Harris last week, I asked him about the vaccination rate for the Army National Guard. He said it was about 53%. He's moved up the deadline for vaccinations from June 30th to March 31st. But with almost half of Ohio Army National Guard not able to go on this particular hospital mission, are you worried about the readiness of the Guard as a force you've been calling on throughout this pandemic?
Well, obviously, I'm not happy with 53%. Now, as I talked to some of the people who are doing the processing today, they told me, I think it was 300 and some people they've added in the last, during this processing. I've talked directly with General Harris a lot about this and encouraged him to do everything that he can to encourage the men and women of the Guard. The federal government set one deadline. General Harris set an earlier deadline. We're coming back and encouraging people, look, you're going into a situation where you're going into a hospital or you're going to a testing place, and we're seeing in some of our testing places 40 to 45% of the people are testing positive. So this is a high-risk operation. You need to be protected. The best way for you to be protected is to get the vaccination. So look, we're not happy with where we are. We're going to continue to push that with our troops.
Governor DeWine, you said that also you were going to, well, you entered a contract with ProLink staffing.
Yeah.
And I was just wondering if you could tell us, like, how many people, where they're coming from? Is it mostly nurses, doctors, respiratory people? If it's been difficult to find people because probably other states are also trying to get these people, any details?
So we'll try to get you that. I don't have that information right now. I know that has been moving, and the way this has worked in coordination with us, the hospitals are themselves then going to ProLink and working that out. So we'll try to get you the best available information we can, but it's hospital to hospital to hospital is how this is actually playing out. But we'll try to do that. Dr. Vanderhoff tomorrow will give another briefing, and he may be able to give you some more information on that as well. Anybody else? Yeah.
Governor, do you anticipate you call up more members of the Guard, and his own Army Guard, or others?
I don't know whether we're going to have to call in more members of the National Guard. No one knows how long this Omicron surge is going to last. We hope we're in a situation like South Africa, where it went up very quickly and it went down very quickly. But when you read the literature and you read what the experts say, or you talk to the experts, frankly, they all tell you, we don't know. So I certainly don't know. As I told members of the Guard today, I don't know how long your deployment's going to be. I'm hoping it's not very long. What we hope is that January, we know January is going to be a very tough month. It's already a very tough month. What we hope is that that doesn't go very far into February. But we don't know that. In this article I read this morning, epidemiologist was talking, and he said, well, it would seem like we would follow South Africa, but South Africa's got a lot younger population than we do, so maybe that won't be true. I don't think anybody knows. General, you want to make a comment about if we went further, where that would come from? And again, that we have not made that decision yet. We're still processing these 2,000, getting them into these hospitals. And let me just add one other thing. The decisions about where they are deployed are made daily. So every single day, this is going to be continued to be fine-tuned. And so they're going to go. I know that some parts of the state, well, why aren't as many members of the Guard in our part of the state or in our local hospital? Every hospital in this state agreed we're going to make the decision based upon where they can have the most impact. So we would anticipate, as this moves south, it's already south, but what we're seeing is continuing increase in Central Ohio, Zone 2, continuing increase in Zone 3. We're seeing maybe in Zone 1 a plateau. We don't know, but maybe. So we would anticipate you're going to see more members of the Guard in Central and Southern Ohio as this month progresses. General?
Sure. Thank you, sir. To answer your second question, out on the mission sites, and those hospitals are both Army and Air National Guard. What you saw here today is Army National Guard, because our Air National Guard members process through the 4 air bases: Toledo, Mansfield, Rickenbacker, and Springfield, the 4 air bases. But as we bring more people on, we have additional capacity in the National Guard, and quite frankly, the balancing act that the governor has to deal with continuously is realizing and recognizing that every National Guardsman we mobilize is somebody from the community. It's your neighbor, it's a family member, but most importantly, every person we mobilize is going to be a school bus driver or that school teacher, and is having an impact on some other sector out there in the marketplace. So yes, we have additional capacity. The goal is to not mobilize more than we need to get the hospitals through this crisis without impacting the rest of the state too adversely. So we monitor this every day. As the governor said, the governor gives me guidance every single day based on what comes from the Department of Health and the Ohio Hospital Association. So again, we have additional capacity to mobilize folks. The question is, what's the right time to do that? And we want to make sure that we don't affect other segments of the market too adversely. First responders, police officers, corrections officers, those are your National Guardsmen. So this is a balancing act we deal with on a daily basis. We certainly don't want to degrade our prison's ability to take care of the prisons by mobilizing those people to deal with another crisis. So this is the balancing act we deal with every single day.
General Harris, given that Governor DeWine said a few more, maybe 300 or so more folks have now been vaccinated, what is the current figure? Is it still 53%? And then in addition to that, the question is, you said that readiness is the most important thing for your folks. Is this a sign that they're not ready for this mission if only roughly half are vaccinated?
Well, the first part of the question, yes, the number is improving. It was 53% just a couple weeks ago. Today, for the Army National Guard, it's 56%. And the good news is there's another 11% that's gotten the first dose, so it's in the process. So Again, it's following the trend that we saw with the Air National Guard. When it became a mandate in the Air National Guard, the numbers very quickly accelerated and are well over 90% now. We expect that to be the same trend that we see in the Army National Guard, and that seems to be what's bearing out. And yes, the reality is the vaccine is a part of medical readiness. We consider it an aspect of medical readiness. I would never put a soldier or airman in harm's way without the best protection we could put on them. Body armor, helmets. I would never put them in arms. I'd be an irresponsible leader if I did that. And this medical readiness is the exact same thing. We're putting folks into harm's way, and I, as a military leader, and every subordinate leader beneath me knows they have a responsibility to make sure we put the best protection on our soldiers and airmen when we would put them into harm's way. Otherwise, we would not be responsible military leaders.
And vaccines are also not being used by the military. Are you concerned that this particular one hasn't been politicized?
Frankly, I'll leave the political discussion to our elected officials. It is concerning to me that our soldiers, listen, these folks who are refusing this vaccine are good people. They're folks who've taken that oath. They're the less than 1% who said, I'll stand up and serve my country. So I certainly don't want to vilify the people who aren't taking the vaccine. I am disappointed that there's so much conflicting information that makes that a very difficult decision. So our goal is to make sure that we provide the best information, continue to keep our service members informed, and encouraging them to make the right decision. As you mentioned, this is about readiness. This is making sure that our individuals are protected when they go into these high-risk environments, just like we would protect them going into any other high-risk environment. Thank you.
When is the deadline for them to get their shots? For the Army National Guard?
For the Army National Guard, it's the 30th of June is the deadline to get the shot. I've imposed a 31 March goal because each day that goes by that our people aren't ready just makes it more difficult for us to respond. We can meet the mission, it becomes more complex.
My question is, I know there's a couple of children's hospitals where kind of requesting maybe some deployments as well. I'm curious if there have been any children's hospitals that you guys send units to, and also if the testing sites is, I'm just curious about how, if I'm an average of Ohio and I want these testing sites, and I'm assuming there's going to be backlog on the testing sites, should I be deploying it ahead of time? Should I, what's the process for that?
I'll get you the specifics on the process for going to the testing sites. There is a website that's established. We want you to register before going to a testing site so we can know what sort of volume is going to go through the sites. We've had situations where we've opened the doors and folks have come through and literally overwhelmed the testing site. So there is a registration process so that we can meter the number of folks that come through the sites for the day. So children's hospitals, I don't know the specifics on that yet. We're in 35, 36 hospitals right now, and I don't know if any of those are children's hospitals, but we can get that information. But there's also, if you go to the coronavirus.ohio.gov website and go to the Ohio National Guard link, you can see all the places. There's a report that we put up every day. You can see all the places where the National Guard is operating right now on this mission.
Let me just add that the testing sites, each testing site is different. We have some testing sites that have made the decision that they can open up for walk-ups. We always recommend people get an appointment, but there are some I know that have started doing it so that you can walk in as well. And so each site is making that decision based upon what they're seeing.
And the governor makes a terrific point. That we're the supporting agency at the sites. We are supporting local hospitals at the sites, so they're the primary leads on these sites, and we simply send personnel to support their operations.
Anybody else?
I have one more question. I'm curious about any thoughts you have about kind of the anniversary of kind of the January 6th events in DC last year.
Okay, I caught the last part of it.
Just any thoughts you have on the anniversary of January 6th events.
The question had to do with any thoughts I have about the anniversary of January 6th, what happened at the U.S. Capitol. I spoke about it at the time. I don't really have any different opinion. My opinion is the same, and that this is a resilient country. This is a strong country. What binds us together is so much bigger than the differences, the political differences, the ideological differences that we might have. We are a unique country. We draw people. If you went through there and looked at the National Guard and their nationalities of where their families came from, and actually one member of the Guard came here at a young age from another country. But what binds us together is some essential, basic beliefs. A belief in the Constitution, a belief in the Bill of Rights, a belief in freedom, a belief in the rule of law, a belief that we can conduct elections and we can conduct elections fairly. These are all things that are basic and that bind us together as a country, where the vast majority of people have those same basic principles that they embrace, because being part of this country is to embrace certain basic core principles. I think we also, as a country, if you look at the things that we are trying to accomplish, again, we have a general agreement. We may not have an agreement about how we get there, but we all have an agreement that it's important for children to have good medical care. It's important for children to be educated. It's important for us to do everything that we can to deal with the problems of poverty. It's important for us to do everything we can to battle this COVID. You could go on and on. So, I understand that today's a day to reflect and talk about what happened a year ago. I fully understand that, and people can reflect on that. But I will say what I said on January 7th at a press conference, and that is there's more that binds us together than pulls us apart, and we need to remind ourselves of that, and remind ourselves that in a political contest, what we agree with, is so much more important than the differences we might have about individual policies and direction of the country. So, thank you all very much. Thanks, General.
What do you have to say to members of your own political party who are trying to downplay what happened?
I think I just said what I said. I think my job as governor of the state is to try to pull people together, and I'm going to continue to try to do that, no matter what the issue is. Trying to pull people together. Again, Ohio is a great state. We have a great future, and it's important for us on basic core principles to remind ourselves we all agree on these basic core principles, and we need to move the state forward. We need to move the country forward. Thank you.
Thank you.